Now I will hold the left lung in anatomical position. This is the anatomical position of the left lung. This is the apex, and here is the base. This is the base. This is the anterior border. Anterior border is sharp. That is the anterior border. And this is the posterior border, which is blunt, which is thick. So this helps us to identify the borders. Posterior border is blunt and thick, whereas anterior border is sharp. This is the medial surface of the left lung, and this is the costal surface. This is related to the thoracic wall, the ribs and intercostal spaces. And we can see the fissure, oblique fissure there on the costal surface. This is the mediastinal surface of the left lung. We will see some of the structures here. This is the hilum of the left lung. Hilum is the area where the root of the lung was attached. We have cut the root. Now this area is the hilum. Below the hilum, this is the area which gives attachment to the pulmonary ligament, which is formed by pleura. Pulmonary ligament was attached here. Now in the hilum there are some structures. This structure is the bronchus, left principal bronchus. We can touch it and identify it. That's an easy method. It is hard because it has got cartilage in it. Then above the bronchus, this is the pulmonary artery of the left side, and in front of the bronchus here is the superior pulmonary vein, and below the bronchus here is the inferior pulmonary vein. The area below and anterior to the hilum, this area is related to heart and pericardium, and this area in front of the hilum here is related to the pulmonary trunk. Above the hilum there is an impression, and the arch of aorta produces this impression. Then behind the hilum here, this big impression is produced by the descending thoracic aorta. The area above the impression of arch of aorta, this is the impression of arch of aorta. Above that level here, the trachea, esophagus, and the branches of arch of aorta are related. The phrenic nerve runs down in relation to medial surface of the lung in front of the hilum, like that, to reach the diaphragm. Then the vagus nerve passes behind the hilum in this area to reach the esophagus. I will show you another left lung. This is the costal surface. This is the medial surface. This is the anterior border. This area is cardiac notch, and below that we have a tongue-like part called lingula. This is the part of upper lobe. This is the anatomical position of the right lung. This is the apex. This is the base. This is the anterior border. This is the posterior border. Posterior border is blunt and thick. Anterior border is thin. This is the medial surface. This is the costal surface of the right lung. This is the oblique fissure. This is the horizontal fissure. And this is the upper lobe. This is the middle lobe. And this is the lower lobe. This is the medial surface of the right lung. Here is the anterior border. Here is the posterior border. This is the hilum. This is the pulmonary artery in the hilum. This is the eparterial bronchus, and this is the hyparterial bronchus. So hilum of the right lung has two bronchi, eparterial bronchus and hyparterial bronchus. Below the pulmonary artery, here is the pulmonary vein. This is the inferior pulmonary vein. The superior pulmonary vein is in front of the pulmonary artery. Here, this is the superior pulmonary vein. One of its tributaries is seen here above the pulmonary artery. So both these are the tributaries of superior pulmonary vein, and here is the inferior pulmonary vein. The area here is related to the pericardium and the heart. This area is related to the inferior vena cava. Then this notch is produced by the superior vena cava. This is the impression produced by the superior vena cava. The right phrenic nerve is related to this area. This impression is produced by the arch of esophagus above the hilum. The area above that here is related to esophagus and trachea. The area behind the hilum, this area, is related to the esophagus, and the area behind that is related to the vertebral column.